All right, we're going to wrap up our notes on the skeletal system by looking at synovial joints. About 10-15 slides here, so not a whole lot. Shouldn't take us very long. Just kind of recapping what we have seen. We left off, sorry, wrong way. We left off last time on major types of joints. Of course, joints is where bones come together in the body, 230 of them. We talked about fibrous joints, we talked about cartilaginous joints, and then we left off on synovial joints. These are what we commonly think of as joints, freely movable joints. Several different types with examples. I want you to think about the movement primarily, what these joints, different types of synovial joints, what type of movements they enable. The first is the ball and socket joint. This is where, just as the name implies, a ball fits into a socket type area. All of these have a little illustration here on a diagram outside the body. This ball fits inside a cup-shaped cavity. Wide range of motion. Think about how your shoulders can move, how you can throw a baseball or a softball, how you can bring it inward and outward like you're throwing a frisbee. It enables all those type of movements at the shoulder, also the hip. These are by far the most wide range of motion that a synovial joint allows. We have the ellipsoid joint. This one may not be quite as common. Our hands and feet are very complex, particularly our wrists. So you'll see several different types of joints here. The ellipsoid joint, one end is an oval shape, and it articulates with an elliptical cavity of another, almost like the ball and socket, but not quite as much range of motion. It just gives different movements in different planes. It can't rotate. So like throwing a baseball, think about that rotation of the shoulder that goes from backwards to forwards. Ellipsoid joints can't quite do that, but they can move all kinds of different planes. Your metacarpals, those are the wrists, or the upper part of the hand here. Well, I guess the more proximal, if you want to be technical on it. And then the phalanges, how those are the fingers. These is ellipsoid joints. It allows movements kind of side to side. And then also, of course, that your fingers can fold down on top of themselves, making like a fist. So ellipsoid joint enables that. While we're in the carpals, the wrist, of course, the gliding joint. This is, these two cubes is a good way to think about it. Think if you had these two cubes next to each other and they had to stay together on these planes here. It can go side to side and backwards and forwards, okay? This is kind of like the joints in our wrist. There's this sliding and this twisting movement. You could also take this cube and kind of spin it around on the other one. Wrist and ankles is where you see gliding joints. The hinge joint, it allows movement in one plane only, just as the name implies. Think about a door. Think about the door to our classroom right now. How we can open and close it, right? It moves one plane, one way, open or closed. We can't rotate on those hinges. We can't, over extend those hinges, so it opens both ways. It's only going to move one way. Think of the knee and the elbow. The knee and elbow, and also your fingers, and mainly your fingers, the end part of your fingers. If you look between the most distal knuckle and the second most distal knuckle on any of your pointer finger, say your pointer finger, how it just bends down. You should not be able to move it side to side. Something would be wrong there. But a hinge joint, this is a good kind of example of how this sits inside here and it moves, one way. The humerus is the upper arm, and the ulna is a great example of the hinge joint. A pivot joint. A pivot joint is found only in mainly one place of the body. It's where this cylindrical surface of the bone articulates with ring of the bone, and ligament. Think about the proximal, or closer to your shoulder, ends of your radius and ulna, the lower arm. By doing this, think about, I should have probably made a video myself, but think about you standing in anatomical position, okay? How your hand and palm is facing forward. And then without moving your shoulder, just turn your hand over. You bring it in and just move it towards your hip or your thigh and rotate it over. And now you can show the back of your hand facing forward. Okay, so that's a pivot joint. It has nothing to do with the shoulder rotating. Instead, it's just at the elbow, but not with the hinge that would move up and down. It's a pivot. It just kind of rotates around on itself. So from anatomical position, I'm sitting here doing it as I'm telling you, like you can see it. But your anatomical position, palms facing forward, and then just simply turn your hand around so that the back of your hand faces forward. That's showing the pivot joint, the proximal ends of the radius and ulna, closer into your elbow. And the last type of synovial joint is the saddle joint. We only really see these in your thumb. It's concave and convex surfaces that complement each other. It's a variety of movements. It's like a saddle, almost looks like a saddle on a horse. See how it is? But this sits on top of it and allows movements rotationally this way, and then also it can kind of come up and down. Your thumb, just kind of take a minute to think about all the ways that you can move your thumb around thanks to your saddle joint, how it is far different from even the ellipsoid joints of your other fingers. All right. So that's all the different types of joints. You'll have an activity dealing with those. Feel free to come back to your notes and look at them. Let's finish up with some injuries. We've already talked about a few injuries, especially like breaks and things. Let's talk about joint injuries, though. Sprains is probably the very most common ones. A sprain is when the ligaments that reinforce a joint are stretched or torn. Think about a sprained ankle here. Ouch. You might roll your ankle. All right, and what it really does internally is it just simply stretches these ligaments where the ligament should be holding it together. This weight comes down on it awkwardly, causing those ligaments to become stretched out or torn even in severe sprains. Okay, severe sprains. Your knee can face all kinds of sprains, all the different ligaments that hold your knee together from the ACL, the LCL, the PCL, the MCL. All of those can be strained or stretched or torn. You hear about the meniscus at times. The meniscus is a cartilaginous injury, which brings us to this next kind of one. A cartilage injury. You hear about this meniscus being torn. Meniscus is simply a part of cartilage that is in many types of joints. Primarily we hear about with our knee, but when this is torn or it's overworked maybe, it can't repair itself. In some small tears and injuries, cartilage kind of can fill in those gaps, but large-scale tears or even just average-sized tears, it's got to be removed by arthroscopic surgery. So it's kind of an invasive surgery. It needs to be gone in and kind of taken out and things replaced. Okay, so we can wear down our meniscus over time, but more likely with a severe sprain or a tear of ligaments, that meniscus also gets torn. So cartilaginous injuries can't be repaired on their own. Strings back to sprains, mild sprains with just stretching, those ligaments will repair themselves with just some basic physical therapy. You can get back to normal. Severe tears, though, however, you reach kind of a threshold in your ligaments where they won't repair themselves. It's kind of over half. You've got to go in and do some type of surgery, or you'll have lack of movement in those joints over time if you don't. And a third type of injury to the ligament, or to the joints, is a dislocation. This is when the bone is forced out of its normal position inside that joint. So think about our hip here. Okay, let's say the ball and socket joint, it is forced out. Sometimes that may be with breaks. It might break part of that, the pelvis that it's stuck into. Sometimes it's simply popping out. You hear about people, my shoulder popped out of place. What does that mean? It means the ligaments are still attached here. They're still holding on. Now, may have been stretched over time, or they may have a stretching injury at that point, but the bone pops out of where it normally is. It can be all kinds of different, not just ball and socket. Think about dislocated fingers. That ellipsoid joint there has been popped out of place. Sometimes if the ligaments don't stretch too severely or they don't tear, these can simply be popped back in. If somebody knows what they're doing, I encourage you, don't do it if you don't try to pop it back in if you don't know what you're doing. But sometimes with dislocation, there are breaks in the bone. So, of course, those, you're going to have some type of operation. Arthritis is, anytime you see itis at the end of a word, it means inflammation. Arthritis means inflammation of joints. Okay, and this results in pain, swelling, stiffness, and limited movement. And there are over 100 different types of arthritis. So, of course, we're not going to cover all of those. Kind of got a good diagram here. Arthritic joints, you can see there's swelling. Redness indicates some pain there. Stiffness, maybe harder to move those joints. One type of arthritis worth looking at is rheumatoid arthritis. This is an autoimmune disease. The body's immune system attacks itself. It causes the bones in mainly the hands. You also see it in other parts of the body, though, to get asymmetrical. Something like this. Somebody with rheumatoid arthritis, their hands may look a little crooked and things like that. It can become crippling over time, of course. This is not going to be, the mobility in these fingers are not going to be as good as they once were. And the last thing we're going to look at is osteoarthritis, typically associated with aging process. It can affect any joint. We mainly see it in the hands just because our hands are so worked. Osteoarthritis is where the cartilage in a joint is worn down. It can cause these bony spurs to pop up. This is a great little diagram picture of it. Healthy knee joint. Here's one. The cartilage is starting to get worn down. You start to see these bone spurs popping up, causing all kinds of pain, inflammation, all these different things. Now, we look at arthritis, the different types of it. Sometimes we like to associate it with older people. And yes, that does affect them more frequently, but it can be younger people too. A common misconception, I know a lot of people say, your mom and dad, grandma's probably all said it to you, don't pop your knuckles. It's going to give you arthritis later in life. There actually aren't any studies that show that. Popping of joints, as long as it's not super twisting, especially like your neck and your back and things like that, that can definitely hurt you. But all it really is releasing air found in the synovial membranes, the synovial sacs that we kind of looked at last unit. So you're not going to get arthritis from popping your fingers. Now, it may pop something out of place or tear a ligament or stretch a ligament and things like that. Most of the time, popping my knuckles now, it's just simply forcing air out of those synovial membranes. So anyway, that's the end of your notes. Hopefully you've learned a lot about the skeletal system. We'll have a few activities this week and an exam.